All right, we're going to continue AAPC Chapter 2, beginning on page 52 with the lymphatic system. The lymphatic system is comprised of lymph vessels and lymph nodes. This system collects excess fluid from the interstitial potential spaces between tissues, and returns it to the heart. The venous end of the lymph capillaries reabsorbs fluid pushed from arterial capillaries into the interstitial space. The lymph picks up excess fluid. The lymphatic system operates without a pump, using a series of valves to ensure fluid travels in one direction, back to the heart. Lymphoid organs scattered throughout the body house phagocytic cells and lymphocytes, essential to the body's defense system and its resistance to disease. Lymphoid organs include the spleen, thymus, tonsils, Peyer's patches of the intestine, and the appendix. Lymphatic vessels. Lymphatic vessels are similar in structure to blood vessels. Lymphatic capillaries are closed at one end. After lymph fluid is picked up, it is circulated to increasingly larger lymph vessels called lymphatics. Lymphatics empty into either the right lymphatic duct or the thoracic duct, both of which are situated in the thoracic cavity. The right lymphatic duct collects lymph fluid from the right arm, right side of the head, and right side of the thorax. The thoracic duct collects lymph from the rest of the body. For the body to maintain an appropriate volume of circulating blood, it is necessary to put fluid back into the main system of circulation. Both lymphatic ducts empty their contents into the subclavian veins. The right lymphatic duct empties into the right subclavian vein, and the thoracic duct empties into the left subclavian vein. Spleen. The spleen is an organ of the lymphatic system in the left upper abdomen that filters and destroys red blood cells that are no longer efficient. It serves as a blood-forming organ early in life and later as a storage unit for extra red blood cells, RBCs, and platelets. Thymus. The thymus is a soft organ located behind the sternum and between the lungs. It has two identical lobes that lie almost on top of the heart and traces up along the trachea. The thymus is prominent in newborns and continues to increase in size during the first year of life. After puberty, the thymus atrophies gradually. The thymus is responsible for T lymphocyte maturation, enabling these cells to function against specific pathogens in the immune response. Tonsils. The tonsils are primarily encapsulated lymphoid tissue located in the throat. They are the simplest lymphoid organs. Tonsils are named according to their location: palatine tonsils, lingual tonsils, and pharyngeal tonsils, referred to as adenoids if enlarged. Peyer's patches and appendix. Peyer's patches are found in the lining of the intestine and help to protect against invading microorganisms. The appendix is a finger-like projection of tissue attached to the cecum, the first part of the large intestine. Medical terms related to the lymphatic system: lymphadenitis, inflammation and enlargement of lymph nodes, usually as a result of infection. Lymphangitis, inflammation of lymphatic vessels as a result of bacterial infection. Lymphedema, swelling of tissue with lymph caused by obstruction or excision of lymphatic vessels. Lymphoma, any neoplastic disease of the lymphoid tissue. Sentinel node, the first few lymph nodes into which a tumor drains, and cancer cells can likely spread from a primary tumor. Thymitis is thymus gland inflammation. CPT code series 38100 through 38999 addresses the surgical procedures of the hemic and lymphatic systems. Okay, section review 2.5. The answers for that are as follows. Number 1, C, with a system of one-way valves. 2 is B, phagocytes. 3 is D, splenectomy. 4 is B, subclavian veins. And finally, 5 is B, lymphangitis. Respiratory system, pulmonary system. The respiratory system includes the nose, nasal cavity, pharynx, larynx, trachea, bronchi, and their smaller branches, lungs, and alveoli. It functions to exchange carbon dioxide for oxygen. Air inspired through the nose and mouth passes to the lungs through a series of branching airways known as the bronchial tree. This series of structures connects the lungs to outside air containing oxygen. Nose. The nose provides an airway to breathe, moistening, warming, and filtering inspired air, serves as a resonating chamber for speech, and houses smell receptors. Pharynx. The pharynx is divided into three regions: nasopharynx, air passageway; oropharynx, air and food passageway; and laryngopharynx, air and food passageway. Larynx. The larynx is the voice box. In addition to voice production, it helps to provide an open, patent airway and acts as a switching mechanism to route air and food into proper channels. Trachea. The trachea is in the mediastinal region and splits into two bronchi at the carina that enter the lungs. There are 3 lobes in the right lung and 2 lobes in the left lung. The epiglottis is a loose flap at the top of the trachea that flips over to close the trachea when a person swallows. Bronchi. At the smallest branch of the bronchial tree, airways are known as bronchioles. Each of these bronchioles narrow further until they end in a tiny pouch called an alveolar sac. Gases are exchanged across the single-cell layer of tissue comprising the alveolar sac into the pulmonary circulation. Capillaries from the pulmonary circulation are also a single-cell layer thick. They form a bed around each alveolus, and gas is exchanged between the alveolus and the capillaries via diffusion. Molecules flow from levels of higher concentration to lower concentration. Medical terms related to the respiratory system: ARDS, acute respiratory distress syndrome; pulmonary edema that can rapidly lead to death; bronchiolitis, inflammation of the bronchioles; bronchoscope, instrument used to examine the bronchi; carina, a projection of the lowest trachea cartilage where the trachea separates into 2 bronchi, used as a landmark for endoscopy or bronchoscopy. The carina is the most sensitive area of the trachea and larynx for triggering a cough reflex. COPD is chronic obstructive pulmonary disease, any group of chronic, progressive, and debilitative respiratory diseases, emphysema, asthma, bronchitis, etc. Dyspnea is difficulty breathing. Endotracheal tube is a tube placed through the mouth into the trachea to help a patient breathe. Hemothorax is presence of blood in the pleural sac. Hyperpnea is abnormally rapid or deep breathing. Lobectomy is surgical excision of a lobe of lung. Orthopnea is difficulty breathing unless upright or in a straight position. Pneumothorax is a collection of air in the chest or pleural cavity. Rales or crackles is abnormal chest sounds heard when air enters small airways of alveoli containing fluid, typically during inspiration. Rhinorrhea is discharge from the nose. Rhonchus is rale or rattling sound in throat or bronchial tube caused by obstructed or inflamed bronchi. Tachypnea is fast or rapid breathing. Thoracoscopy is examination of the pleural cavity through an endoscope. Thoracotomy is incision into the chest wall. Thoracentesis is removal of fluid from the pleural cavity by a surgical puncture, pleural tap. Tuberculosis is a highly contagious chronic bacterial infection, usually affecting the lungs. And we had pretty much gotten rid of TB, but unfortunately it is back, and it is back with a vengeance. Wheeze is whistling sound usually caused by air passageway obstruction, common in asthmatics. Application to documentation. Technique. After induction of satisfactory general anesthesia, flexible fiber optic bronchoscopy was performed. Airways were essentially normal with minimal secretions. No endobronchial lesions. The patient was kept supine and his neck was prepared with DuraPrep and draped in sterile fashion. A transverse incision was used and deepened with cautery. The pretracheal facial plane was entered and the medial mediastinoscope easily passed. Samples of lymph nodes were taken from the subcarinal area, the right tracheal bronchial angle area, and the low pretracheal area. All were negative for neoplasm. The wound was irrigated, checked for hemostasis, and closed with absorbable sutures, and a dry sterile dressing was applied. In this documentation, it is important to understand anatomy to determine where the biopsies were taken. The CPT 30,000 through 32999 code series addresses surgical procedures of the respiratory system. Now for 2.6 section review. The answers for 2.6 are as follows. Number 1 is B, at the bifurcation of the trachea into two bronchi. Number 1 is D, at the bifurcation of the trachea into two bronchi. Number 2 is B, nose. Number 3 is also B, incision into the chest wall. Number 4 is C, alveoli and capillaries. And finally, number 5 is dash penia, which is the suffix that means breathing. Right. The digestive system. The gastrointestinal tract or GI tract and its ancillary organs make up the digestive system. The GI tract begins in the mouth and ends at the anus. The continuous structure winds through several body cavities and encompasses a multitude of structures and organs. The system mechanically and chemically breaks down food into minuscule or molecular size for absorption into the bloodstream and use at the cellular level. Food enters the digestive system via the mouth. The teeth and tongue mechanically break food into smaller particles to provide greater exposure surface area for the chemical processes that follow. Chewing is called mastication. Salivary glands surround the mouth and secrete saliva, which is comprised primarily of water, mucus, electrolytes, and salivary amylase. Salivary aids in early phases of chemical digestion and liquefaction of food. Food is swallowed, and peristalsis is the esophagus, and peristalsis in the esophagus moves food through the upper thoracic cavity into the stomach. Stomach and small intestine. The opening to the stomach is the cardiac orifice. The fundus of the stomach is the rounded upper portion above the body of the stomach. The body of the stomach is the main portion, and the lower portion is the pyloric antrum. The pyloric sphincter leads to the duodenum. Food moves through the stomach into the small intestine, which is divided into 3 sections. The first section of the small intestine is the duodenum, the second is jejunum, and the distal portion is the ileum, not to be confused with the ileum, a bone in the pelvis. And then you have a picture of the structures of the stomach, which is also located in your book, in your anatomy pictures. Practical coding note. The name ileum for the distal portion of the small intestine can be remembered and separated from the ileum of the pelvis bone by the letter E. Each of the names of the small intestine, duodenum, jejunum, and ileum, include an E and no I. Large intestine. The large intestine begins just above the ileocecal valve at the cecum, with the appendix attached at the bottom. There are 4 portions of the colon: ascending, transverse, descending, and sigmoid or pelvic colon. The ascending colon proceeds from the ileocecal valve upward to the hepatic flexure on the right side of the abdomen. It becomes the transverse colon and turns downward to become the descending colon at the splenic flexure on the left side of the abdomen. The descending colon gives way to the sigmoid colon and ends at the rectum. The internal and external anal sphincters at the terminates of the rectum control the flow of fecal material leaving the body. Then you have your large intestine picture. Ancillary organs. Ancillary organs such as the pancreas, liver, and gallbladder are also part of the digestive system because the chemicals they produce are necessary for chemical breakdown of food. The digestive or exocrine pancreas makes digestive enzymes that are secreted into the intestines to help break down food. The liver filters blood and makes bile. The gallbladder stores bile produced in the liver. Bile secreted into the intestines from the gallbladder helps to break down fats. Medical terms related to the digestive system include aphasia, inability to swallow; bariatric, pertaining to the prevention of and control of obesity; biliary, pertaining to bile; buccal, pertaining to the cheek; cholecystectomy, surgical excision of the gallbladder. Please know that. Cholecystitis, also know that. Inflammation of the gallbladder. Colectomy is excision of part of the colon. Colonoscopy is examination of the colon and may include examination of the terminal ileum with an endoscope. Diverticulitis is inflammation of one or more diverticulum. Diverticulosis is presence of a number of diverticula of the intestine. Diverticulum is small pouches that protrude from the wall of a hollow organ or structure. Diverticula means more than one diverticulum. They are most common in the lower portion of the large intestine and increasingly common with age. Dysphagia is difficulty in swallowing. Epigastric, region above the stomach. Esophageal, pertaining to the esophagus. Gastralgia, pain in the stomach. Gastroenterologist, physician specializing in the gastrointestinal system. Hematemesis is vomiting blood. Herniotomy is excision into a hernia. Ileostomy is creating an opening through the abdominal wall into the ileum. Laparotomy, surgical incision into the abdomen. Pancreatitis, inflammation of the pancreas. Pharyngeal, pertaining to the pharynx. Rectal cell, herniation of the rectum into the vagina. Sigmoidoscope, instrument used to view the sigmoid. Sphincter, a muscular ring around a lumen or hollow structure. Splenomegaly, enlarged spleen. Splenorrhaphy, repair of the spleen. Stomatitis, inflammation of the mucous membrane of the mouth. Sublingual, below or beneath the tongue. A synonym for that is hyperglossal. Transoral means through the mouth. Wharton's tumor is a tumor found in the salivary gland. The CPT 40490 through 49999 code series address surgical procedures of the digestive system. Application to documentation. The patient first was placed into occlusion using Carless bolts of 8 millimeter in length. The jaws were put into proper occlusion using 24 gauge stainless steel wires. A buccal incision was made just above the sulcus, carried down through the subcutaneous tissues with the electrocautery. Xylocaine 0.5% with epinephrine had been injected for hemostasis. The periosteum was elevated and the patient was noted to have a comminuted fracture of the maxilla, creating a Lefort 1 fracture. Placement into occlusion had placed the patient in good reduction. In the documentation above, understanding that buccal refers to the cheek provides an understanding of where the incision was made. Okay, section review 2.7. We have number 1. The answer is A, duodenum. Number 2 is C, liver. Number 3 is B, transverse colon. Number 4 is A, buccal. And finally, number 5 is D, peristalsis. All right, I'm going to stop right there, and then I will probably have to do at least 1 or possibly 2 more videos. All right, you guys, we're making our way through chapter 2.